Medicare for All, you don't need the subsidies because Medicare for All is fully paid for. And that's the starting place.
It's a cornerstone policy for some Democrats running for president, but Medicare for All is unpopular with voters in key swing states, states that are going to determine the next president: Wisconsin, Pennsylvania, Michigan, and Minnesota. According to a new poll, 62% say bad idea. 36% say good idea. Our next guest says he is not surprised. Avik Roy is the president of the Foundation for Research and Equal Opportunity, which is a nonprofit, nonpartisan think tank. He also is a former healthcare policy advisor to Mitt Romney in 2012 campaign. So, Avik, what was the attraction, and why are people, upon further review, not attracted to it?
Well, look, everybody loves a bumper sticker, right? And Medicare for All is a bumper sticker. You could say, let's just abolish all the private insurance companies because the private sector is bad. They want profits, and profits are bad, even though actually a lot of insurers are nonprofit. But that's the thinking, and the problem is when you put it on paper, like Elizabeth Warren did earlier this month, and you actually put it down line by line and say, how would we pay for this? Whose taxes would go up? How many jobs would you kill? It's a big problem.
So it's a big problem when taxes go up. The number that makes sense, how much would taxes go up annually if Medicare for All was instituted?
So in Elizabeth Warren's own campaign document, she said that taxes would have to go up by $20 trillion over 10 years, which means that the U.S. tax burden would go up by almost 50%. Now, at my think tank, the Foundation for Research on Equal Opportunity, we published an analysis on Monday where we actually went line by line through the Warren plan, and we don't think it adds up. We think it'll only collect about $12 trillion in taxes, not 20, because of all the economic growth it will kill and all the jobs it will kill and all the tax revenue and capital that will leave the country because people won't want that tax.
So they also say when it comes to single payer, that, that might be on the surface something that would look good to people without great insurance, but single payer is problematic too.
Absolutely. I mean, first of all, again, you're going to be taking away health insurance from about 180 million Americans who have private insurance and giving them this one-size-fits-all government plan, which, again, for some people, they may want that. You know, it's a big country. But for a lot of people, the quality of care is going to be worse. And the other piece of this is that spending is going to skyrocket because what Elizabeth Warren is saying, what Bernie Sanders is saying is it's going to be free for everybody. There's no deductibles, no premiums, no cost sharing. Well, it's never free. Right. Somebody's paying for it, and that's the rest of us.
Doctors aren't happy with it. They need Medicare Advantage to pay their bills. We're going to have less doctors, less access. Avik Roy, you do this for a living every single day. Hopefully we get politics out of this and we try to solve it. Thanks so much for joining us.
I hope so.